Alrighty, let's go ahead and begin. Hi, everyone. I'll be kicking us off today. My name is Shailin Jotishi. I'm the CEO of the Journal of Science, Policy, and Governance and a senior analyst at the think tank New America in Washington, D.C. For those of you who are new to our organization, for 10 years, JSPG has been the international open access platform for students, postdocs, policy fellows, and early career researchers to contribute ideas touching every imaginable dimension of science and technology and innovation policy debate, ranging from how to tackle space debris to pioneering new models for climate action. Through strategic partnerships like with our friends at AAAS and the UN, governments and national and international sector leadership groups, our mission is to publish, nurture, and help elevate the next generation in science policy through substantive and accessible research and writing. This event marks the first of a second of a six-part expert dialogue series co-hosted by JSPG and AAAS, which coincides with our latest call for papers, generously supported by the Kavli Foundation. We invite early career scientists and engineers and policy professionals to submit policy position papers covering a myriad of topics that would help us better build a future of American science and science policy. This call for papers celebrates the 75-year anniversary of Vannevar Bush's seminal text, Science, the Endless Frontier, which set the stage for much of U.S. science policy in recent history. Each of our six expert dialogues will help authors get a sense of where they might focus their writings across key thematic areas relating to Endless Frontier. All recordings are posted on our YouTube channel, which I hope you'll follow. A link will be in the chat. We invite ambitious, bold, entrepreneurial, and innovative ideas to help tackle the nation's most urgent and important science policy problems. The deadline to submit is April 4th, and you can learn more at sciencepolicyjournal.org. I hope you'll connect with us on Twitter, Facebook, LinkedIn, and Instagram. We also have a monthly newsletter for special opportunities and ways to engage. All links will be put in the chat momentarily. If you have any questions, please don't hesitate to contact myself or my team members, Joanne Lee or Adriana Bankston. Without Joanne and Adriana, we would not be gathered today. So much gratitude to both of you. Today, we have an amazing panel to shed some light on how we can better optimize U.S. science policy to respond to public health challenges. These speakers are so illustrious that their CVs alone would fill a volume of JSPG. So I'm going to briefly introduce our stellar lineup before turning over to our moderator. While I do that, please follow them on Twitter, tweet at us, share your thoughts. We'll be amplifying you throughout the session, and the person who tweets the most will be invited to contribute to a special JSPG blog article at the end of our webinar series. I'm going to share my screen so you can get a sense of the great lineup we have today. So you should see that on screen. First up is our moderator, Aaron Heath, Director of Federal Relations at AAAS, the world's largest science society, and my partner in crime as chair of the JSPG Governing Board. Aaron has an extensive background in science policy and journalism in the US and in the UK. She helps lead the ESEP Coalition, the Golden Goose Award, and many other national efforts. Carrie Wolnitz is Acting Chief of Staff and Associate Director for Science Policy at NIH, another sage of science policy. Carrie advises the NIH Director on a variety of matters of importance for science and health. She was previously at the Association of American Universities. She's president of the United for Medical Research and taught at Georgetown. Bob Cook-Deegan is professor at Arizona State University and based in DC at the Center on Science Policy and Outcomes. Bob has an extensive career at the National Academies, the National Center for Human Genome Research, and the Office of Technology Assessment in Congress, RIP. Prior to joining ASU, he directed Duke's Center for Genome Research, Ethics, Law, and Policy. Tanaz Razuli is Senior Director of Public Policy and Strategic Outreach at the AAMC, the Association for Medical Schools, Hospitals, and Other Health Institutions. She's helped steer AAMC's advocacy and policy efforts for 15 years on a variety of topics, was Executive Director of the Ad Hoc Group for Medical Research, and also taught at Georgetown University. And finally, we have Jenny Leray, who is VP for Strategy and Communications at Research America, the nation's largest nonprofit alliance working to make medical research a higher national priority. Jenny brings a strong industry lens, having directed U.S. policy at AB and Abbott, and president of the Susan G. Komen Advocacy Alliance. She's held many high-ranking positions on Capitol Hill with Barbara Mikulski, Nita Lowey, and in the Clinton White House. Everyone's full bio is available online. Panel, thank you so much for joining us. We're honored and excited to learn with you. We'll turn things over to Aaron to take it from here. We'll have a discussion with the panel, followed by audience Q&A. Please share your reactions and questions in the chat. The JSPG team will be monitoring. Live tweet, the graphic you see on screen is also available online. The person who tweets the most during this session will be invited to contribute to a JSPG blog in May. Also, a nugget for tuning in. Stay tuned for a very exciting JSPG AAAS video feature during the 2021 annual meeting taking place next month. Erin, thanks so much for moderating. Please take it away.
Thanks, Shaylin. AAAS is very excited to partner with JSPG and the Kavli Foundation on this series, and as well as the call for papers that will set the stage for the next 75 years in science policy. We hope many of you watching will submit papers, and that this session and the others in the series are going to help get the ideas flowing. So before I jump in, I will encourage you at any point to submit questions you have in the chat. And again, Shaylin mentioned this, there's a lot of activity on social media, so we'd love to see you engage there as well as here. I'll turn now to our panel. I'm so happy to be here with all of you. Our topic is public health, and I think it's fair to say that all of us here share a passion for public health and biomedical policy. So here's the first thing I want to ask you. When Vannevar Bush drafted the Endless Frontier Report, it was in response to a series of questions by President Roosevelt, and one of those questions was, with particular reference to the war of science against disease, what can be done now to organize a program for continuing in the future the work which has been done in medicine and related sciences? So I want to turn a version of this question now to all of you, 75 years later. What is truly needed to carry us into the future of biomedical research? And Carrie, for this, I'd like to start with you. You have a front row seat over at NIH. Where do we need to go from here?
Yeah, thanks for the question, and I'm really happy to be here today. First, I think it's important to note we've come a long way, baby, since that question was posed by Vannevar Bush. So to Vannevar Bush. So I think it's important to know that this time period is often called the golden age of biology, and I think that's true. If you've looked at the just explosion in knowledge and advancement in medicine, in the life sciences, the intersection with the physical sciences, the really unprecedented scientific opportunities we're at the cusp of. I feel like I've been saying that for 20 years, and it's been true for 20 years, which is what makes the field so exciting. It's pretty extraordinary, but there's still a lot to do going forward. I think part of that is building on this knowledge base that we've been investing in for any number of years. We've had a truly incredible investment in fundamental research, and I think we're starting to see many of the fruits of that paying off. A great timely example, of course, is the mRNA-based vaccines for COVID, which are really built on fundamental investment in basic biomedical research. But I think it's also given us space to look at ways in which we can take advantage of the enterprise we have and explore new and innovative approaches, whether that is improving the diversity of our workforce in many ways, to thinking about some of the lessons we've learned through COVID, which are actually really interesting, particularly if you think about how we quickly build public-private partnerships and take advantage of technological advancements, funnel innovation, for example. So I think we have built a very strong foundation, and there's nowhere really to go but up, which is maybe even more exciting than it was at the time of Vannevar Bush's report.
Thank you. Great start. So Naz, I'd like to turn to you. Our organizations have been working closely for many, many years. You represent our nation's med schools. So from where you sit, what's needed to carry us into the future?
Well, it's daunting to go after Carrie. So it'll be daunting to go after any of the speakers on this panel. So I'll start by just saying ditto. And also thank you for the invitation, and really excited to be part of this discussion. So I'll build on what Carrie said, because I do agree with everything that she highlighted. And I think as we look to the next 75 years and beyond, I do think there's a lot of opportunity for us to think about the scientific enterprise more in people terms, in the context of people. And part of that is, as Carrie said, building on the workforce and ensuring that we're people-centered in terms of how we're thinking about the scientific workforce, that we're building and retaining and growing a strong, diverse workforce. And diversity, I think, across multiple dimensions, right? I think there's opportunity to be diverse in terms of how we're thinking about our workforce in terms of discipline, for example. So I think there's a lot of opportunity to think about it in a people-centered way, about science in a people-centered way there. And then I also think, as certainly one of the things that we've noticed as a result of COVID has been that there continue to be gaps that we could be plugging in how science actually reaches people, how we're interacting with the public in terms of the ability of science to reach people where it's needed and be applied how it's needed. Some of that conducts beyond the conduct of science itself and extends, beyond the four walls of the lab, so to speak. But I think it's really core as we think about earning public trust and confidence and support for science. And I also think along the same lines that we need to sort of clarify what we mean when we say people focused and people emphasis, because I think sometimes that gets misinterpreted to suggest that we should have a goal that we've identified and only work toward that goal. And as everybody that's tuning in today knows, that's not how science works. That's not where our greatest investments yield fruit. And so really trying to clarify that you can have a people-centered focus without being so prescriptive in terms of what we expect as the outcomes of those investments to be.
Excellent, thank you. Jenny, I'm going to turn to you now. So like Tanaz and me, you're at an organization that advocates for science in the STEM community with a focus on biomedical research. Where do you see the future heading?
Well, first, I want to just pay some kudos not only to this great panel, but to the president and to the affirmation of the whole premise of investing in basic research. I mean, we would not have the COVID vaccine had it not been for decades of basic research investment. And Carrie alluded to that, as did Tanaz, but I almost feel like it can't be said enough, that very short time frame, that's because of all the dozens of years that came before it and the work of groups like AAMC and Carrie before she was at NIH. And I'm sure ASU's government affairs shop, so many advocates working on behalf of supporting NIH under some very tough budget circumstances. We're finally getting out of a situation where we had a budget cap that made it very tough. And, one point I'd like to make too is that we need to really use, those of us in this community need to really use this opportunity to force a major reemphasis on science and innovation in the US. We are spending far less than our competitor nations as a percentage of our GDP. We're like 14th. So NIH is part of that overall, scope of science. And I think this is a wonderful opportunity to really make the US much more of a science-centric society.
Well put. Bob? You have the perspective of someone in academia and someone who's a well-known expert in biomedical policy. What's your take looking forward?
So just a little bit of a historical footnote here. So Vannevar Bush wrote those questions that were then bounced back to him to write back to President Roosevelt to answer, right? And if you look at Science, the Endless Frontier, the very first example he uses of something that made a difference during World War II was penicillin. And if you look at that, there's actually this wonderful book by James Baxter called Scientists Against Time that talked about all the things that were done during the war, like radar, which was incredibly important in winning the Battle of Britain. It's probably, many people think that the war turned because of the invention of radar. But actually, if you think about it, health inventions mattered as much or more than any of the physical science inventions. So anti-malarials, vaccines, and penicillin all grew directly out of the World War II effort. And actually, that's the last time we had a government-owned and operated effort that was as urgent as what we're experiencing right now. And the analogies don't stop there, because if you think about the 2 leading vaccines that we got in 10 months, which is utterly incredible, grew out of DARPA and NIH funding in the underlying, the lipid nanoparticles plus the messenger RNA delivery device. These are the first products that have ever been developed using that kind of a technology. It's an incredible story, and it's going to save millions and millions of lives if we can get our act together and actually delivering the things that science got onto the table for us. That's the real flaw of the US healthcare system. And Europe's not doing a whole lot better. So the other thing I wanted to, so in addition to, that's a resource that folks can read. There are actual chapters on penicillin, on anti-malarials. The vaccine stuff, they have to go to Dartmouth, the recent scholarship on that. But the thing that I wanted to point out is actually we haven't learned all of the lessons, but the place where Kerry works now is 4 orders of magnitude larger than it was at the end of World War II. Going into World War II, the total budget of the National Institutes of Health was $700,000. Think about that. That's 1 R01 grant for 1 year. That was the total budget of the federal government for NIH. So that whole story of the wartime effort was not the story of NIH. NIH began to grow immensely right after the war. By 1950, NIH's budget alone was $50 million, which is what Vannevar Bush asked for all research, including military research and the physical sciences, in addition to the life sciences. And that NIH was just getting started, because Mary Lasker and Florence Mahoney were gearing up their lobbying effort to build NIH's budget, and it exploded during the 1950s and 1960s. So that research enterprise got huge. And by the 1980s, why did biotechnology originate in the United States? Because we were the best place on the planet that was doing biomedical research. And there's no accident about that. So it had direct implications not only for health, but also for jobs and wealth. So all that stuff, that's that story, but we've kind of begun to forget that. As Jenny alluded to, in fact, when they did the first census of who pays for biomedical research in the world, the first time WHO did that about 2 decades ago, the United States accounted for more than half. Now we're drifting below, and China's going to overtake us by the end of this decade. So we're forgetting those lessons, and I don't know what to do about that. I think maybe the COVID crisis is going to renew attention to the importance of biomedical innovation. And also the other thing that I can say is this is about public health. So there's an aspect of research that we're pretty bad at in the United States, which is figuring out how to fix our system to deliver the goods and services that innovation delivers. So I'll just stop there. I've gone on long enough.
Thank you. So this next question, I want to focus even more on what we're going through right now. And you've all of you have dipped into this already. So it's the pandemic. Even though it has been a shock to the system in myriad ways, I've actually been talking about pandemic preparedness for a long time. And I'd love to ask, in what ways do you think we were prepared for COVID-19? And again, we've touched on some of this. And then what lessons do you think we'll take away from this pandemic to be more prepared in the future? And I'll start with you this time, Bob.
So what were we good at? So when Hopkins did the assessment of who's best prepared in the world, the United States came out #1. What were they talking about? Well, we have CDC, the best infectious disease collection of experts on the planet. We have the National Institutes of Health, the premier biomedical research institution on the planet. We have the biggest biotech industry. We have the biggest pharmaceutical industry. Of course we're ready, right? Whoops. I don't know what we say about this, except those are not the parts of the system that broke. CDC and FDA did not do such a good job with the testing, especially early on, but we could have caught up. I think what we've learned out of this pandemic is this system is really big and complex. And if we take health seriously, we have to think about, in addition to doing the miraculous basic science and translational science that gets things onto the table, we need to be thinking about what happens after that. And that's where we fell down. So, and we don't understand that instantly. That's a topic for research unto itself. I don't know a soul on the planet who understands the US healthcare system and how to fix it.
Carrie, you've certainly been involved in this conversation. What are your thoughts?
Well, I think that certainly, as already been alluded to, one of the, I think we'll probably spend a lot of time thinking of in the after effect how we could have done better. I want to focus for a moment on places where I think we were very prepared on the science side. We've already talked about the taking advantage of many years of investment in basic research that allowed us to develop a vaccine very quickly, but it went beyond vaccines. The relationships built with private industry through many years. NIH has set up a number of recent public-private partnerships over the past decade, and taking advantage of those relationships allowed us to accelerate vaccine development, allowed acceleration of treatments and diagnostics, certainly. And I think also the investment in the infrastructure related to clinical research and clinical trials allowed us to answer scientific questions very quickly. So, on the ground, and desperate physicians and healthcare providers were trying all sorts of things. This was an entirely new virus. There was a lot of interest in coming up with new treatments and new medicines, repurposing already existing and improved drugs very quickly. And whether or not those were effective were questions that could only be answered by science and setting up the sort of gold standard of controlled clinical trials. And we were able to, we saw those stood up in large scale fashion very quickly, in no small part because we had the infrastructure in place that we were able to take advantage of, bring together. I think we've learned lessons on how we could do that even better and even faster next time. But certainly it was an example of something that worked very well in terms of taking advantage of all of that scientific knowledge in a very rapid speed fashion. And I think it's easy because time during a pandemic seems to move in very strange fashion. And for folks who have been quarantined or locked in their homes for a long time, it may seem like this has gone on for a very long time. But in terms of medical advancement terms, the vaccine development, the treatments, the clinical guidelines, those have really moved forward at lightning speed. And that piece of the pandemic response is arguably a success story.
Thank you. Other thoughts from our panelists, either Jenny or Tanaz?
Aaron, yeah, I'd like to just comment on the public health piece of this. You can't find smarter, more dedicated public servants than at the CDC. But the CDC, as a federal agency, has been poorly funded for a very long time. Most of its funding goes out to the states, as does NIH funding also goes out extramurally. But our state and local public health departments depend greatly on CDC funding. Carrie was using the term infrastructure, our public health infrastructure. To say it's creaky would be an overstatement. And that's what we found, you know, very small in terms of staffing, very poor resourced in terms of technology, information technology. And, you know, I think that those chickens have come home to roost, you know, greatly. So, you know, I really hope, we really hope, I know many of us really hope that this is an opportunity where we finally commit to, you know, stronger long-term funding for our public health system.
Yeah, I'll just echo that and really everything everyone said, because I do think, you know, some of those infrastructure challenges are exactly what have led to some of the so-called, you know, last mile challenges that Bob was talking about before. Totally agree with Carrie in terms of what a moment for decades of investment in fundamental science leading to this almost magical situation where we now have, you know, not one, but 2 vaccines that have been authorized and how many more in the pipeline potentially right behind it. But then not being able to actually get those shots in the arm, so to speak, you know, I think are in part a result of some of the infrastructure challenges that Jenny was talking about. You know, I think we also saw a lot of supply chain issues on the front end as well that I think are going to lead to sort of a national reckoning in terms of how are we approaching, you know, are we ensuring that we have some sort of domestic capacity and have a diversity in terms of options on the across the supply chain, but also that we're continuing to strengthen our global partnerships and relationships, because an outbreak anywhere is a threat everywhere. The other thing that I'll just mention sort of along the same lines is I do think, you know, it's been really inspiring, I think, to watch how seamlessly the scientific community really pivoted from, you know, the work that they were doing to this novel threat. And, you know, that's in large part to the infrastructure that Carrie described. I think we saw something similar on the clinical side, where you saw clinicians really pivot very seamlessly to suddenly treating this novel threat, and you saw the public health professionals pivot, you know, to focusing on this novel threat. I think where we face challenges, though, is that all of those things still seem to be happening in silos. We need better connections and better linkages between, you know, the scientific enterprise, the public health community, and the clinical community. And, you know, representing the medical schools and the teaching hospitals, I can say, you know, there's a sort of a misunderstandings, I think, among these different communities about what each of these communities is doing. And so I feel like that's certainly an opportunity for us to think about in a post-COVID world, hopefully one day, a post-COVID world. How can we strengthen those linkages and get a better understanding so healthcare understands what public health is doing and vice versa, and similarly with the scientific community more broadly?
So Erin, I wanted to pick up on something that Carrie said that's really, really important. But also make another point, which is the only way to deal with a pandemic is to have already been ready. You have to have done your homework and be ready before it hits. And if you look at the portfolio of things that we needed to have ready in the federal constellation, NIH and DARPA were ready. How do we know that? Look what happened. We got vaccines, we got the new tech stuff. The technical fixes, we were poised and ready to go. That part of the system worked. CDC was not ready. Its testing capacity was not adequate, and the infrastructure that it funds was also even weaker than CDC Central was. So we screwed up there. And that's a part of the system that we need to shore up. And I think that'll be one of the lessons, is how do we do that? How do we do that efficiently and effectively? But I think the fundamental message is, oh my gosh, we have to have a plan that's on the books, on the shelves, ready to be pulled off as soon as this happens. And it can't just be about the technical fix. That part, boy, please don't break that part as we're trying to fix the rest of it. But the the rest of the system really needs some planning, and we really need to be ready the next time. And this is not going to be the last one of these. I hope it may be the last one in my lifetime of this magnitude, but it's not going to be the last one in the history of our country.
So switching gears a little bit, thank you all for your words. One of the topics I expect JSPG writers might be interested in are the impacts of the pandemic on the scientific enterprise. And we've been hearing a lot about this, particularly on women, early career researchers. What do we need to do to address this and keep the science going strong in this challenging environment? And Jenny, I'd like to start with you. I know you and your colleagues have been collecting some of these impacts. What do you think?
Well, we've been working very closely with Tanaz, in fact, and with Carrie and her colleagues at NIH to really build a case for the need for supplemental funding to cover the non-COVID related research that was impacted over the past year, and that's still being impacted. Labs are from everywhere from 20 to 30% in operation to 70%. So a lot of work is not being done. And one of the things that we've been working on, we've been doing this for a number of months now, is really building the case to help to shore up that COVID impacted research. And not only the research itself, but the impact that it's had on the careers of early career scientists and others who are perhaps less established. So I'm going to turn it over to Tanaz because she has been working on this very diligently. I will say we just did a meeting with our alliance members. We're an alliance of patient groups, research institutions, industry, and universities. And we were really pulling from our alliance members for specific examples because storytelling is very compelling. Storytelling is not going to build the credibility, but it can help with the convincing. And so all the numbers in the world can be insufficient if you really don't have those very human impacts. So that's what we've been working on. But I'll turn it over to Tanaz to comment as well.
Well, I think that's extraordinarily well said, Jenny, and especially the piece about the need to really tell the story to help illustrate sort of what the consequences of lack of investment may be or are already sort of manifesting. And I think, yes, absolutely, we're seeing the impact of this pandemic on research across the board, and in particular on the research workforce, and in particular the early career workforce. And yes, we're seeing it manifest in different ways for different populations, even among those groups, and certainly individuals that have caretaker responsibilities, children or other caretaker responsibilities. Women tend to be in that category, and so seeing a difference in the impact there. And what a tragedy I think it would be after, in recent years, I think especially, we've been putting so much emphasis and so much focus on really trying to think about how can we ensure that we are building a strong pipeline of a research workforce and really investing in and supporting the next generation of researchers. To lose that as a result of this crisis, I think and take steps backward, I think would really be tragic in a lot of ways. So absolutely, we're working very hard in trying to convey that to Congress. And I think we've been encouraged that we've seen strong bipartisan support in both chambers for that investment. But ultimately, it's going to come down to larger, bigger picture dynamics. And so those stories that Jenny was talking about, I think, are especially critical in ensuring that it continues to stay on the radar screen and policymakers truly understand what the consequences are likely to be.
Thank you. Well said. Other thoughts from our panelists?
Yeah, I think, it's important to note that even pre-pandemic, there were issues in the biomedical enterprise with gender equity, with the support of communities of color, particularly African-American scientists, where we were doing sort of an appalling job, frankly, and that it was a difficult system for early stage investigators to enter and to survive. We had a hyper competitive system. The pandemic has exacerbated, for all of the reasons that Jenny and Tanaj just mentioned, a lot of those pre-existing in ways that we need to make sure, first of all, to address in the near term. I think there's the very real practical issue of what risk mitigation measures can we put in place to support folks to prevent them from getting lost from the system, because what we're seeing, particularly for female scientists, which as Tanaz mentioned, might be disproportionately affected by caretaking responsibilities. I literally have the door locked behind me so my children don't bust in during this seminar. So I have some personal appreciation for this phenomenon. But also, it is an interesting opportunity to take a deep breath and think about the system going forward. You know, in the spirit of Vannevar Bush, how do we think about the enterprise going forward, not just in terms of the monetary support that has already been alluded to, but also, you know, is this an opportunity to rethink, how do we get new blood into the system? How do we increase the diversity of our enterprise? How do we think about the incentives and disincentives in the system that allow for a more inclusive scientific workforce and perhaps an enterprise that allows more innovative approaches to research than we've had in the past? I do think you should never waste a crisis, and this is a crisis opportunity that allows really all of the stakeholders in the enterprise to come together and say, you know, what have we learned and how can we use that to improve the system going forward? At NIH, we're thinking about things like, we once upon a time, and I know many of you have been involved in these conversations for a long time, we've said, oh my gosh, virtual study sections, we can't do that. The world will stop spinning on its axis, right? Well, overnight, suddenly, in order to keep the enterprise going, we went all virtual in our study sections. And that is not necessarily a perfect solution going forward, but we've shown that perhaps the world space of what is possible was wider than we thought it was. And then when push comes to shove, in fact, there are all sorts of creative solutions that allow us to adapt and maybe even improve in some ways, particularly in ways that allow us to cast a wider, more inclusive net. I don't know if this is true of the audience here, but one of the things that has struck me as I've done virtual talk after virtual talk is how diverse the audience is when you're able to do a virtual panel, a virtual event. Suddenly you're getting in people who might be prohibited from traveling to a place and participating. And those sorts of, how do we think about all of these creative solutions we've put in place that have positive aspects and carrying them forward, I think is something that we need to bring to the table to think about, particularly this issue of the impact on the scientific enterprise from the pandemic and how we do better going forward.
So I want to talk a little bit about, there's a sentiment I've been seeing again and again that there's a need to build and foster trust in our public health agencies. What are your thoughts on how best to do that? And this is for anyone who wants to weigh in on the panel.
I can jump in there. Yeah, so I think that one of the challenges that public health has is that we all take it for granted. If you think about it, you don't really think about public health until something goes wrong, right? And then suddenly you realize, wow, this thing called public health, and you know, why'd they drop the ball, right? So I do think there's this tendency to take it for granted. And for years, I think as a result of that, we've underinvested in the public health infrastructure, as Jenny talked about, which only heightens the chance of something going wrong. And then there's outrage and mistrust that results as a result of that. And so I do think it's really critical that in this moment in time, one of the lessons that we take away from this is that we have to really invest in a strong and robust way in our public health infrastructure. We need to rebuild it so that so that we're not taking it for granted. And right now, the way that we're investing in public health is essentially this whack-a-mole strategy that takes us from crisis to crisis, where you have these large infusions of cash to deal with whatever the crisis is. And then as soon as that crisis is no longer on the front pages of the newspaper, then suddenly that money becomes up for grabs, or we just stop investing in it altogether and we end up back where we started again. So I do think having more sustained and reliable and really strong investments in public health and public health infrastructure are going to be really critical to keep us from falling into the catastrophes that I think lead to some of the mistrust. I think in addition to that, setting aside those infrastructure challenges, I also think that there are communication challenges that we have in public health. And again, some of that stems from the fact that we're just taking for granted and don't feel like we need to communicate what's happening in terms of public health on a day-to-day basis. But I think there is this sense of, sometimes we see a sense of trying to protect the public from some of the threats or the challenges that might come. And that translates into communications that lead to mistrust and sort of reinforce mistrust. And so I think if we want our public health agencies and our leaders to have the public's trust, I think they need to trust the public and ensure that we're communicating honestly, candidly, scientifically based information on a regular basis in a way that obviously doesn't lead to panic, but that also recognizes that the public is going to respond much more effectively to candor than to sugarcoating or hype or other sorts of efforts along those lines.
Could I jump in? That's just great, Tanaz. The sugarcoating, I think occurs in part because while within, amongst science professionals, we accept this notion of skepticism. That's part of the scientific process to be skeptical at the beginning, right? As you're hypothesis testing. Well, the public has every right to be skeptical too. And they're going to be even more skeptical if they feel that they're getting a sugar-coated message. Clearly, this past year, though, we had some really strong tailwinds, right? We had, what I call a complete political weaponizing of very basic public health information. Where wearing a mask did and is still, somehow became a political act. And then, we have the internet and misinformation, which, studies show, for example, in terms of the anti-vax world, they're actually a very small piece of the internet, but they have a way of penetrating very broadly across sites. And if you look at the pro-vaccination organizations, they're not as well distributed across the internet. Anyway, so my point is, the political tailwinds and then the struggle that, many fields are having in misinformation, are two other, complicating factors that we need to take into account.
Bob, you're on mute.
Yeah, just one point that I wanted to make is we used to have this belief that trust grew out of trustworthiness. That is, if you just say the truth and keep to it, then you will build trust. But as soon as you violate that, you lose it, and then it's really hard to build back again. And I think that's true. But I think what we've learned over the last couple of years is that's necessary, but not sufficient. So I've got my prop for this, which is my Tony Fauci bobblehead. which I think proves that consistently trying to tell the truth and stay out of politics only kind of works. And there are parts of our culture that don't respond to that. No matter how trustworthy you are, you can't solve that problem. And I think we've got a problem there. And I don't think anybody understands it. I don't think the federal government has the data to understand it. I think the places that have that data are the Facebooks, the Amazons, the Googles, and they aren't sharing it. But I don't think they understand it either, because they aren't finding it possible to manage the problem either. So I actually think we have a fundamental gap in our understanding that we need to understand, or else we're not going to be able to solve the anti-vax problem and, you know, whatever comes after that.
I also think that much in the way we've talked a lot about investments and how we've been able to respond very quickly because of years in investment. One place where maybe we haven't done as great a job in investment and could do a better job going forward is really in community relationship building and engagement. Engagement is one of those words that people like to talk about a lot. And you know, we talk about it in the context of public trust and science. But I will say that sometimes we, the scientific community, are guilty of talking about engagement and talking about public trust when what we're actually saying, well, if only the public was smarter about science, they would trust me and they would believe me. And that's not what engagement is about. That's what education is about, and that's what lecturing is sometimes about. But we, you know, building relationships with communities, establishing that trust, that is much like an investment in fundamental research, something that needs to be deliberately taken over time and can't be a one-way unilateral form of communication. I think, you know, in particular, a striking place we've seen this where we've really started from our back foot in COVID is when you look at communities of color that have been disproportionately affected by the pandemic. The biomedical research enterprise as a whole has not had the sort of in-depth relationships and engagement with those communities as we probably could have. And so we are instead resting on a historic foundation of distrust that we have not invested the time we probably should have to counter, because we sort of took it for granted that, oh, if we have the magic medicine, everyone will just, you know, take it and you know, trust in that. And I think one of the lessons we need to take away is building those relationships, doing the engagements, and really making the investments to develop that foundation of trust, which, like any relationship, it's like marriage, right? It needs work. It needs continual bilateral communication. That is in itself an investment worth making. And I think we really need to, you know, if you're looking for your to-do list for the next 75 years, that is a excellent item to put on the list.
Just here, Carrie, beautifully said. I'm tempted to jump in because I wrote an op-ed, but I'm not going to because I don't think I can say anything better than you did. But a huge problem, and there's a whole science behind it as well. I mean, part of it is goodwill and trust, but you know, there's some really good social science around this as well that we need to, you know, take advantage of.
Well, thank you for all the good comments. I want to turn now to the audience Q&A. We have so many good questions. So I'll start by a question from Kim. I'll start with a question from Kim. She wants to know if everything is a priority, nothing is a priority, what would you say is a misplaced priority when it comes to optimizing science policy to respond to public health challenges? It's a tricky one.
I might take a stab at it. So I mentioned before about how sometimes I think when we think about, and I'm looking at it through the lens of policymakers. I spend a lot of my time talking to the Hill and to members of Congress and their staff. And so I think when they're thinking about, okay, how can we make science responsive to public health challenges, I think sometimes, they expect there to be a direct line, right? Connect one dot to the other. And if you invest in, I don't know, one type of research, that it's going to lead to the cure for that particular condition immediately. And I think that is, as everybody I think who's tuned in today knows, that's again not how science works. That's not where we get the best bang for our buck. And yet there is a real pressure, I think, on policymakers to demonstrate results for the investments that they advocate, that they speak out for. So I think that tension between trying to identify, really specific targets where the science is really promising and where there is, a lot of opportunity, and being too prescriptive in terms of what we expect the outcomes to be, or where we expect the outcomes to be, is one that I think gets at the question, in the sense that, we have to, yes, it's important to have priorities generally, but we have to allow appropriate flexibility to allow the science take us where those answers are. And I think COVID has been the perfect illustration of that. And I'm hopeful that as we move forward, that that's something that resonates more broadly beyond our own community.
And I'll take a stab. I mean, that's one of those questions. That long silence is because that was a brilliant question that makes us really uncomfortable and we don't know how to answer it. But I will raise one other issue, that it's a hardy perennial, and I don't think we have a good solution to it, but we know that there is a problem. And that is the conservatism of the project selection mechanism that we've converged on for very, very good reasons. Merit review and group-based peer review. That's fantastic at sustaining a body of science, but it also tends to militate towards conservatism. And if you look at all the kinases that are related to cancer, or the 20,000 genes in the human genome that have been thoroughly studied, you will notice that 90% of the literature focuses on 5% of the molecules. Why is that? Well, that's because when you go to the study section, you're judged for not only how innovative your methods are, but also, are you likely to get the results? Because we're investing money in you and we want to make sure that that's useful. And that's really reasonable, but that's our default mechanism. And we don't have the wildcatting that's fostered. And that's why it was important, for example, the mRNA stuff. You'll see that NIAID is huge in that, but so is DARPA. And that adventurous kind of high risk stuff is something that I think in our biomedical research enterprise, it hasn't been bred out, because if you think about DNA sequencing, Jeff Schloss managed to make NIH behave like DARPA. And that's an incredible success story. So it's not that it's a complete roadblock, but I think if you were going to say we've got misplaced priorities, I think it's conservatism and inertia in our project management system. And it's everybody knows this is a problem, from Francis Collins all the way down to the the Center for Scientific Review at NIH. They know it, and nobody has come up with a really good solution to that. I'd be interested, Jenny, and I'm sure you guys are thinking about that, and Tanaz too, and Carrie.
Yeah, Bob, you'll probably be surprised to know that I agree with you on some of this. Maybe not whether is DARPA the perfect solution. I don't know, but I do think that there is truth to the fact that although the biomedical enterprise is built and founded on the principle of innovation, the enterprise itself isn't prone toward innovating itself, right? The whole enterprise, in many ways, built into the fabric of how we do science, is really set up to sort of maintain the status quo. That's not altogether a bad thing. I'm not saying it's time to, blow up the system and start anew. there's a lot of reason why you don't want a constant shifting from the next shiny bright object to the next shiny object, right? But there is a need for balance, and this gets maybe, you know, full circle to this point of people centricity, right? So, you know, the enterprise at the end of the day is made up of people, and we are, you know, when we look at how we gauge science, how we judge, you know, where to spend our resources, a lot of that is concentrating the resources in the hands of a relatively small segment of the possible people that those resources could be spent in. And that's in part because we are, you know, to that notion of conservatism, continuing to sort of reward the same people, the same lineages of people. And so thinking about how do we break some portion of our enterprise free from that status quo that allows us to bring in new people, a more diverse pool of people, new ideas, new approaches, is something that I think that we should constantly be asking ourselves, and also, you know, questioning always whether or not the approach, just because we've been doing it for many, many years, doesn't mean that it is the right approach or the best approach for today. You know, entering the federal government from outside of the government, I am perhaps more guilty than most of constantly saying to my staff, don't tell me we've always done it that way, or that's just the way it is. I don't find that generally to be an acceptable answer. And I think the entire enterprise needs to be continually doing that, asking ourselves whether or not, just because this way works now or it has worked in the past, you know, is it possibly time to experiment with new directions? And I don't think we should view those kinds of questions as a threat. I think we should view them as opportunities to do better and shift the enterprise in positive, innovative ways.
Thank you. Mark wants to know, what do you feel like the balance between fundamental and applied research is now versus the time of the endless frontier, and how do you feel it should be balanced going forward? Bob, I feel like you might have something to say on this one.
Yeah, so the Bush argument at the end of World War II, his argument was, gosh, we had this kind of stock of science that was on the shelves, and then we took all these scientists out of their academic labs and moved them to Los Alamos and to the Lincoln Labs and to places. And what they did is they stopped doing fundamental research that was undirected, and they started doing basically engineering and very focused research to get things in the hands of people who needed them to win a war. And he was worried that we were just going to keep going down that pathway. So his argument was there's a responsibility that the federal government is uniquely positioned to carry out, which is to make sure that we have that stock of knowledge on the shelf for when we need it. And I think everybody buys that. I actually think that's been a robust bipartisan consensus for a solid 7 decades. And I also think it has the virtue of being true. So I think that's not where we have a disagreement. I do think what he was worried about didn't really come to pass. I don't think anybody's going to accuse NIH of not doing enough basic research. And, you know, the emergence of the Center for Translational Sciences was in fact a reaction of maybe it's not doing enough of the other stuff. And I think if there's a flaw in our system, it's building those bridges that Carrie was alluding to of there are a lot of things that the government can't do. It's not going to produce penicillin. Companies are going to produce penicillin. It's not going to produce a vaccine. Companies are going to produce a vaccine. So it's a complex ecosystem. And I think as we get to the back end of that ecosystem, that's where the weaknesses in our system begin to appear most dramatically. I think So the conclusion there is maybe we're really good, and I don't know that it's deployment of resources. I don't know that it's the relative balance of resources. I think it's understanding and fixing the system so that we're better at it at the back end of that. I don't think it's absence of money that's the problem. I think our financial models and our business models and our culture isn't doing the work that it needs to do to fill the gaps in that part of the innovation process.
If I could just add to that, I really agree with Bob. Those pathways are critical. And the Center for Translational Research, in a sense, what they're doing is working on the science of translation. So they're not necessarily funding research, later stage research, but they're helping to create those pathways. You know, it's like regulatory science. There's a whole method and around, you know, how do you approve a drug, and how do you do so efficiently and safely? This is similar. The translational research world also needs to be looked at as a science in and of itself. So what can we take from the incredible experience of the COVID vaccine, the diagnostics, you know, the Operation Warp Speed, and the other ways that NIH and other agencies collaborated with the private sector? And how can we take some of those models and deploy them you know, into non-pandemic uses? Now, part of it is going to require resources. You know, part of the speed came from an enormous bolus of resources, whether it was at the FDA or NIH. But I still think there are ways, there are processes, cultures that we can take from the pandemic experience and help with this translational issue.
Sandra asks, on the note of improving trust, public trust, in what ways might efforts need to address trust from disadvantaged communities whose distrust may stem from historical racism in biomedical research? Carrie.
An excellent question. And like I said, I think one that cannot be solved overnight. This really involves an investment in time, in resources, in relationship building, in engagement outside of our comfort zones. So, you know, I already mentioned the fact that we need to continually think about improving diversity in the enterprise. And I mean that in the fullest sense of the word. I think if you look at the literal enterprise and the ecosystem, we still have a long way towards building partnerships with different kinds of communities, whether that's different institutions, whether that is different pools of scientific disciplines, whether that are non-traditional partners. I think at NIH, if you look at something like the All of Us program, which is sort of our flagship precision medicine initiative, where we've committed to having a cohort that is among the most diverse we've ever seen in biomedical research, and represents communities that are traditionally underrepresented in biomedical research. In order to do that, and they have been meeting that goal, we have worked very closely with non-traditional partners, church groups, for example, groups that represent disadvantaged communities, groups that represent rural communities. And that has all been about relationship building and engagement and thinking outside of the box of sort of our go-to enterprise. And I think that we need to think very holistically about that. I will say it is also important to recognize and think about and listen to those communities about the roots of that mistrust and how we can build that trust going forward, whether that is through very practical thinking about consent and how do we ensure that we are appropriately tailoring consent to allow greater inclusiveness in the research enterprise of people and specimens and data in a way that builds and does not diminish trust, to thinking about, how do we build transparency and accountability around all of our processes so people don't feel like they are excluded from the process or the enterprise, but rather that they have a front row seat and are partners in the enterprise. And all of that really takes the willingness to listen, to move outside of the status quo, and really invest the time and resources in a very deliberate way to build that long-term relationship.
And one other place to start is to stop screwing up. So my students, when we talk about this, they know three things, right? Walking into class, even before we talk about it, they know about Tuskegee, the Havasupai, and Henrietta Lacks. And those are not things, those are not all things that were done by evil people. Tuskegee started out as well-meaning. The Henrietta Lacks stuff started out as well-meaning, and the Havasupai actually did do some diabetes research before it turned to other stuff. So we just need to be educating all of us not to screw up. So the first step necessary is to be trustworthy. And the problem is you can do that for the rest of your life and you still got the stain that you have to wash out of your clothes, right? And it may never go away.
I'll just add, echoing everything that Bob said, and also sort of reiterating Carrie's point on engagement. I think the other sort of key to engagement is that it has to be sustained over the long term, right? So I think sometimes there's, around a particular project, perhaps there might be engagement on the front end, but there isn't that follow through all the way throughout the course of it. And so ensuring that there's a commitment, that it's a cultural commitment to engagement, I think is really key and really critical to earning back that trust over the long time and living up to the trust that you're asking for, as Bob said.
Thank you. I'm going to try to get to two more questions. Nuri asks, what are some of the non-monetary ways to build the science infrastructure to better respond to public health threats? It's not just about throwing money.
So the word that we like to use in Washington is coordination. And when it works, it actually, it can be magical and sometimes it does work. But that's, and what does that amount to? That amounts to having career incentives to not just focus on narrow silos, but actually be paying attention to what's going on in places that relate to your work. I got to tell you, our academic infrastructure has so many incentives that fight against that, where most of the rewards are for, being the very, very best on the planet for a very narrow area, and you don't so much get rewarded for thinking about how your work relates to the rest of the world. That's a very deep problem. And the beauty, the genius of the academic system is that it actually cultivates quality. But at the same time, it does have incentives built against that. And I just think, again, we're back to balance and vigilance. And we do need to reward people who actually get really, really good at thinking about the implications of what they do, in addition to doing a really, really good job of doing good science.
I'll add to that.
Yeah.
Bob, are you still?
No, I was just
going?
thinking, the other three of you know a whole lot more about coordination than I do because I'm an academic.
Jamie, go ahead.
Well, I was going to kind of riff though on what you were saying about academia, and talk about what our CEO Mary Woolley likes to refer to as the public context of science. And so, how do academicians in the sciences and in the public health arena, how do they become more cognizant of really the public context of what they're doing? And one of the ways that we've been doing that at Research America is working with early career scientists. Erin knew I was going to work this in, but we've been running a micro grant program. We're in our third year with funding from Rita Allen. we are funding 19 early career science groups across the country. And they are working really in the field, in their communities. Not all are public health oriented. One is called the Influencers. It's a group of Pitt med school and graduate students, and they are working out in their community around vaccine hesitancy. So I think part of it is about breaking down those walls early on in a career path. You know, one can be incredibly effective at dialoguing with the public and maintain an incredibly successful academic career. You know, you can walk and chew gum at the same time, so to speak. You know, some people will then move away from the academic world, but, you know, there are folks like Peter Hotez, many, you know, Anthony Fauci, obviously the most famous right now, but Peter and so many others who have really, really figured out some incredible ways of communicating publicly the importance of public health.
And I think there are important cultural issues that I think there's room for shifting. And, you know, just as an example, the culture of data sharing and transparency of research results, I think certainly as we all, as an entire global enterprise, scrambled to redress the COVID pandemic, we saw a lot of the barriers that had previously been put up around data sharing, around rapid dissemination and cooperation around research results fall, and you know, hopefully will give us a good platform to improve in this regard in the future. I also think it highlighted some of the weaknesses of our infrastructure around data sharing and open science and transparency of results. And so, you know, that's a cultural shift, and we, you know, need to continue to move the entire culture forward towards best practices in any number of ways. And money can be helpful in incentivizing those cultural shifts or disincentivizing, depending on whether or not you're giving out the money or withholding it. But certainly it's not necessary to sort of win the hearts and minds and move the culture in the right direction.
You know, one other, just to inject a ray of hope here, is there is one mechanism that doesn't involve money. And that's that institutions tend to react to incentives from the top. And they tend to behave better when they know somebody's watching. So I think one of the things that's going to be really, really interesting to observe is that the Office of Science and Technology Policy, which is one of the only convergence points for this R&D apparatus that we have, is now going to have two scientists who are extremely highly respected, Eric Lander and Alondra Nelson, thinking about that and actually engaged and sitting at the table when cabinet level decisions are made. That can have a pretty profound influence on the agencies paying attention to how they collaborate with each other. If they're being measured for that, they're much more likely to behave that way than if what we had before, which was all the incentives were dump the responsibility on governors and mayors for this particular crisis. So you don't get blamed in the center. And I think we'll see, but I'm really optimistic that we're going to have some life scientists and social scientists who are really paying attention to how the agencies are collaborating. That doesn't cost money, but it may change behavior.
Well, I love ending on a ray of hope, and it is time to wrap up. So I want to thank our panelists. I want to thank all of you for joining, and I want to now turn it to Shaylin for concluding remarks. Shaylin, you're up.
Thanks so much, Erin. What a great discussion. Thanks so much to our panel for just a really riveting discussion here. Folks, you've had lots of interesting nuggets of wisdom. A reminder to subscribe to JSPG on YouTube, follow us on social media, sign up for our newsletter, and join us next Friday for a session around advancing STEM education at the undergraduate and graduate level. Thanks again for tuning in, and we'll look forward to seeing you next week. Thanks again for our panel, and thanks very much to Aaron for moderating this discussion.
Yeah, Aaron, thanks so much. It's always such a pleasure to work with you.
Thank you.
Thanks. Cheers, everyone.
Great job.
Bye now.